Good evening. I am Lalema Aneja Dang and with me is Vaibhav Srivastav. The headlines. Health Minister Dr. Harshvardhan says 300 districts in the country are unaffected by COVID-19. Progressive increase in COVID-19 recovery rate in the country, over 7,000 patients cured and discharged. BRICS foreign ministers discuss impact of COVID-19. India emphasizes on reforms of multilateral systems to deal with the pandemic. Government calls upon all states and union territories to facilitate interstate movement of trucks and lorries carrying essential goods. Wheat harvesting across the country continues at brisk pace amid lockdown, and UIDAI permits around 20,000 common service centres to offer Aadhaar updation facility. Health Minister Dr. Harshvardhan has said 300 districts in the country are unaffected by COVID-19. Interacting with the heads of autonomous institutes and public sector undertakings under the Department of Biotechnology, DBT, through video conferencing today, Dr. Vardhan said another 300 districts have few cases and 129 districts have hotspots, and government is focusing on these districts to contain the spread.
All over the country, we know that just over 300 districts are thoroughly unaffected by the disease. About 300 districts again are our non-hotspot districts where we have just very few cases, and roughly 129 districts are the ones where we have significant number of cases, say more than 15 or maybe slightly less than 15, which we call as hotspots. And these are the places where we are focusing our approach on with the cluster containment and disease outbreak.
Dr. Harshvardhan said scientists are going to contribute a lot to the corona warriors in the fight against COVID-19. He said scientists have made significant progress in the development of indigenous antibody test kits and RT-PCR test kits. The minister said ICMR has done an exemplary job and ramped up testing capabilities. He said DBT is supporting research on vaccine development and it has come quite ahead in the direction. Dr. Harshvardhan today held a review meeting with Delhi Lieutenant Governor Anil Baijal, Delhi Health Minister Satyendra Jain, Commissioners of Municipal Corporations, District Magistrates and DCPs of all districts of Delhi, and Central and State and District Surveillance Officers and Heads of Government Hospitals. Later in a tweet, Delhi LG Anil Baijal said government has to emphasize on extensive testing, faster results, meticulous contact tracing and isolation with strict perimeter control in the containment zones. He asked all stakeholders to work in unison to break the chain of transmission. Mr. Baijal also pitched for stringent standard operating procedure to ensure safety of health workers in both COVID and non-COVID hospitals.
The number of confirmed novel coronavirus cases in the country has climbed to 29,974 today, while the death toll rose to 937. The Health Ministry data said the number of active COVID-19 cases stood at 22,010, while 7,026 people were either cured of the disease or discharged from the hospitals, and one had migrated. Briefing media in New Delhi, a Health Ministry official said there has been progressive increase in the recovery rate in the country. The official said no new cases of COVID-19 have been reported from 17 districts in the last 28 days. He said the WHO data shows that the combined population of 20 nations where maximum COVID-19 cases have been found is almost same as India's population, and these nations have together reported 84 times the number of cases reported in India.
दुनिया के 20 देश की पॉपुलेशन करीब हमारे देश की जनसंख्या के बराबर होती है, और कल का अगर हम WHO का डेटा देखें तो हम पाते हैं कि अगर हम उन 20 देशों में आए हुए कंफर्म केसेस की संख्या लें और अपने देश की कंफर्म केसेस की संख्या लें तो हम पाते हैं कि इंडिया में उन देशों के मुकाबले 1/84, यानी कि उन देशों में इंडिया में जितने केसेस रिपोर्ट हुए उससे 84 गुना ज्यादा केसेस रिपोर्ट हुए हैं.
The official said compared to the 20 nations where maximum COVID-19 cases have been reported, India has reported 1/200 times the number of deaths as the total number of deaths in those 20 countries. He said currently there are no approved therapies, including the plasma therapy, for the treatment of COVID-19.
Plasma therapy is one of the therapy which is being experimented with. However, so far there is no evidence to support it as a treatment. यह अभी भी experimental stage पर है. इसका कोई evidence नहीं है कि इसको treatment के रूप में इस्तेमाल किया जा सकता है. US FDA ने भी इसे एक experimental therapy के रूप में ही देखा है. ICMR ने एक national study को launch किया है ताकि वह इस therapy की efficacy के बारे में study कर सके. इसलिए इस विषय में यह clarify करना बहुत जरूरी है कि जब तक कि ICMR अपनी study को conclude न कर ले, robust scientific proof available ना हो, तब तक इस therapy को केवल हम या तो research या trial purpose के लिए ही उपयोग करें.
Home Ministry officials said the central team to Ahmedabad has found that the administration has adequate facility to shift patients to dedicated COVID hospitals as required. She said 19 to 20 patients have been shifted to such hospitals. The official said Ahmedabad's central team has found there is joint supervision by police and medical teams at entry points to quarantine clusters. They also found that hospital facilities are satisfactory based on discussion with the patients' relatives as well. She said Ahmedabad administration has taken various steps, including house-to-house survey and use of data sources such as electoral rolls, Project Lifeline and others to conduct surveillance of vulnerable population and perform their testing. The Home Ministry official said Ahmedabad's central team has suggested that with the help of central government, the state may set up a multidisciplinary research unit at Sardar Patel Hospital where COVID-19 testing facilities can be set up.
IMCT ने सुझाव दिया है कि राज्य सरकार केंद्रीय सरकार की सहायता लेकर सरदार वल्लभ भाई पटेल अस्पताल में एक मल्टी डिसिप्लिनरी रिसर्च यूनिट की स्थापना करे, जहां उपकरणों की कोविड टेस्टिंग के लिए फैसिलिटीज डेवलप की जा सकती हैं. IMCT ने पाया कि लॉकडाउन का सख्ती से अनुपालन हो रहा है. पुलिस ने काफी इनोवेटिव सॉल्यूशंस यूज किए हैं जिससे कि सोशल डिस्टेंसिंग का उल्लंघन ना हो.
The Home Ministry official informed that the Ahmedabad team found that a Gram Yodha Samiti has been constituted in every Gram Panchayat, which facilitates doorstep delivery of essential items and adherence to lockdown measures. The team has recommended this system be followed in other states too. The central team visited Kathwada and Naroda shelter homes and suggested that labourers may be accommodated for maintenance of social distancing in 33 shelter homes where adequate facilities are available. The official said IMCT Ahmedabad has found that pharma industries are functional in Sanand industrial base. Auto industry too is operational at 50% capacity. Out of 50,000 workers, around 30,000 workers have returned. She said the IMCT held discussions with various stakeholders including textile and diamond industries who are the major employers of labourers, and most labourers have received the pay for the last month. She said interministerial central teams found that Surat administration is using modern techniques for detection and tracking of cases.
Maharashtra continues to remain the worst affected state due to novel coronavirus as numbers keep spiraling in Mumbai, Pune, Malegaon and Aurangabad. In Pune, the district administration has decided to temporarily migrate 70,000 families from Pune city. It has also decided to deploy 5,000 special police officers for the city. Malegaon, another hotbed of COVID-19 pandemic, recorded as many as 49 fresh corona positive cases in the last 12 hours. Similarly, Aurangabad, Yavatmal and Hingoli also saw a considerable rise in the number of COVID-19 cases. Maharashtra has as many as 8,590 COVID-19 positive cases with 369 deaths. Our correspondent has filed this report.
As 4 employees in the Mantralaya in Mumbai tested positive for novel coronavirus, the Maharashtra government has decided to shut the Secretariat building as well as the new administrative building for next 2 days, that is on 29th and 30th of this month. Both these buildings will be sanitized for the next 2 days. In another major decision, the Maharashtra government has decided to send about 100 buses to Kota in Rajasthan to bring back nearly 2,000 students stranded there due to the lockdown. Maharashtra Transport Minister Anil Parab said the students will be first brought to Dhule and from there they will be sent to their native places by state transport facilities. Meanwhile, in the midst of the prevailing gloomy picture, Gadchiroli district in Vidarbha has not reported a single COVID-19 positive case till date. Kunal Shinde, AIR News, Mumbai.
The Interministerial Central Team, which is on a visit to Ahmedabad in the light of COVID-19, praised the Gram Yodha Committee set up by the administration in all the villages. The committee recommended the model to be adopted in the whole country. Here's a report from our correspondent.
The central team continued its visit in Hyderabad beyond its initial schedule and visited various places on the fourth day today, assessing the containment measures that are in place in the city. The team visited Gudimalkapur Vegetable and Fruit Market, one of the biggest markets in the southern part of the country, and inspected the measures that are being taken to prevent spread of coronavirus. The team members interacted with the shopkeepers and also visitors and inquired about maintaining social distancing. The team also visited the control room of the Greater Hyderabad Municipal Corporation and checked the calls it is receiving during lockdown and watched a demo of how the problems raised by members of public are being addressed by the authorities. The visiting central team is having a close look at COVID treatment methods, facilities to patients at hospitals and quarantine centers, besides inquiring about the methods being followed in containment zones and assessing the lockdown impact on normal people in Hyderabad. The team will give its report to the central government. Lakshmi, AR News, Hyderabad.
The Interministerial Central Team IMCT that is taking stock of the COVID-19 situation in Hyderabad has visited Gudi Malkapur Market and Control Room at the Greater Hyderabad Municipal Corporation to inspect the measures in place to contain the spread of the coronavirus. The team has extended its visit and examined various containment measures on the fourth consecutive day today. The central team, led by Additional Secretary in Jal Shakti Ministry Arun Baroka, has been assessing the measures being taken to contain the spread of the virus, treatment to positive patients, hardships that people are facing due to the lockdown. The total number of infected cases in Tamil Nadu has crossed the 2,000 mark, with 121 new cases reported today. 103 of the new cases are from Chennai, while a 5-day-old baby from the neighbouring Chengalpattu district has also been confirmed with the infection. However, 27 people were discharged today and the active caseload is 902. One more person succumbed to the disease in the last 24 hours, taking the toll to 25. Meanwhile, the 5-member Interministerial Central Team visited several places in Chennai for the fourth day today. The team, led by Dr. Thirupugaz, Additional Secretary, National Disaster Management Authority, met the State Director General of Police in Chennai and saw for themselves the functioning of the police control room on COVID-19 pandemic. They later took stock of the ground situations in a fishing hamlet and 2 urban primary health centres. They also visited a private firm in the city manufacturing ventilators. More from our correspondent.
The Tamil Nadu Chief Minister Edappadi Palaniswamy has reiterated that without the full-fledged support of the public, it would be hard to contain the virus. He reviewed the COVID-19 situation today with the 12 special teams of senior officials on lockdown. In the meeting, he observed that a large section of the public have failed to understand the gravity of the situation, as the control of the people's movement still remains a challenge, especially in big cities. He asked the officials to do more on awareness creation. Meanwhile, the opposition DMK leader MK Stalin has demanded the state government to launch a website for the benefit of the people from the state working abroad to register themselves for repatriation once the lockdown is either withdrawn or relaxed. Jai Singh, AR News, Chennai.
India is well prepared to provide sufficient water to every household during the ongoing COVID-19 pandemic. Talking exclusively to All India Radio News, Jal Shakti Minister Gajendra Singh Shekhawat said domestic consumption of water has increased during the ongoing lockdown, but it is being balanced as industry consumption has significantly decreased. He said Centre has asked states to ensure adequate supply of water to every household so that people can maintain their basic hygiene.
प्राथमिक रूप से राज्यों को ही अपने यहाँ पर प्रबंधन आपूर्ति सब विषयों को देखना होता है, लेकिन चूंकि माननीय प्रधानमंत्री जी का देश के साथ में सामने संकल्प है कि हम 2024 तक प्रत्येक ग्रामीण घर तक पीने का पानी पहुँचाना सुनिश्चित करेंगे। इस क्रम में जो जल जीवन मिशन और हर घर में जल पहुंचाने की जो योजना बनाई गई है, उसका काम इस दृष्टिकोण से न रुके और न प्रभावित हो, इसके लिए हमने निरंतर राज्यों के अधिकारियों के साथ में, राज्यों के मंत्रियों के साथ में और राज्यों के इंजीनियर्स के साथ में वर्चुअल प्लेटफॉर्म्स पर मीटिंग्स करके उनको इस बात के लिए निर्देशित भी किया है, उनसे इस बात का आग्रह किया है कि अपनी योजनाएं बनाने का काम जो है वो हमको शीघ्रता के साथ में पूरा कर लेना चाहिए।
Government has called upon all the states and union territories to take urgent action so that blockades of trucks and lorries at interstate borders is cleared for smooth movement of essential goods. Road Transport and Highways Minister Nitin Gadkari today held a meeting with state and UT road transport ministers through video conference. He stressed the need to facilitate truck and lorry movement to ease up lives of the public in the light of the lockdown. Mr. Gadkari urged ministers to intervene in such matters and ensure resolution through the local and district administrations. The minister also underlined to follow the health advisories and other guidelines like proper distance, wearing masks, use of sanitizers, both by the driver and the cleaners. Mr. Gadkari informed that his ministry will start a helpline to resolve the transportation issues. The minister suggested that state transport ministers should explore operationalizing app-based two-wheeler taxis, especially in rural areas, which will assist farming communities with smoother movement. This will also provide new employment opportunities.
Wheat harvesting across the country is continuing at a brisk pace amid the lockdown. Standard Operating Procedure SOP related to crop harvesting and threshing is adhered to by the farmers and workers. The government has circulated the SOP to the states for compliance in order to protect health of farmers and farm workers and to contain the spread of the coronavirus. As reported by the states, over 98% of wheat crop has been harvested in Madhya Pradesh, whereas in many other states, including Rajasthan and Uttar Pradesh, around 90% of harvesting has been reported. The procurement of pulses and oilseeds at minimum support price MSP from farmers is also currently in progress in Karnataka, Andhra Pradesh, Telangana, Rajasthan, Maharashtra, Uttar Pradesh and Haryana. The government today said that record sales of fertilizers took place during the lockdown period. During 1st to 22nd of April, the sale of fertilizers to farmers' community was over 10 lakh tons, which is 32% higher than the last year of sale during the same period. Chemicals and Fertilizers Minister D.V. Sadanand Gowda has said his ministry is committed to ensure availability of fertilizers to the farmer community before sowing time. A report.
With the concerted efforts of Department of Fertilizers, Railways, States and Ports, production and supply of fertilizers in the country is going on without hindrance. During 1st April to 22nd April, dealers purchased over 15 lakh tons fertilizers, which is 46% higher than last year of sale during the same period. Fertilizer Ministry said there is no problem of fertilizers and state government have sufficient stock. As loading and unloading of fertilizers are in full swing at fertilizer plants, railway stations and ports, physical distancing practices are being maintained, masks and all other preventive equipments are being provided to labourers and all other working staff. With Dipendra, Anupam Mishra, AI News, Delhi.
This is All India Radio, bringing you a special program on COVID-19. A reminder of the headlines before we move on. Health Minister Dr. Harshvardhan says 300 districts in the country are unaffected by COVID-19. Progressive increase in COVID-19 recovery rate in the country. Over 7,000 patients cured and discharged. BRICS foreign ministers discuss impact of COVID-19. India emphasizes on reforms of multilateral systems to deal with the pandemic. Government calls upon all states and union territories to facilitate interstate movement of trucks and lorries carrying essential goods. Wheat harvesting across the country continues at brisk pace amid the lockdown. And UIDAI permits around 20,000 common service centers to offer Aadhaar updation facility. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
दर्शकों का पसंदीदा धारावाहिक श्री कृष्ण जल्द आ रहा है डीडी नेशनल, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें। फ्री डिश 001, टाटा स्काई 114, एयरटेल 148, सन डायरेक्ट 302, वीडियोकॉन D2H 149, डिश टीवी 193 और डेन 138। आगामी आकर्षण धारावाहिक श्री कृष्ण। लोकप्रिय धारावाहिक महाभारत प्रतिदिन दोपहर 12 बजे और शाम 7 बजे डीडी भारती, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें। डीडी 60, टाटा स्काई 1194, एयरटेल 151, सन डायरेक्ट 326, वीडियोकॉन डीटीएच 480, डिश टीवी 197 और डेन 522। समय याद रखें, दोपहर 12 बजे और शाम 7 बजे। प्रतिदिन देखें लोकप्रिय धारावाहिक महाभारत।
अथ श्री महाभारत कथा।
India has emphasized on reforms of multilateral systems to deal with the current challenge of COVID-19 pandemic. In his remarks through video conference at the BRICS Foreign Ministers meeting on the impact of novel coronavirus, External Affairs Minister Dr. S. Jaishankar said that the COVID-19 challenge emphasizes all the more the need for reform of multilateral systems. He said reformed multilateralism is the way forward. Dr. Jaishankar referred to the centrality of development and growth in the global agenda. He emphasized that the pandemic is not only posing a great risk to the health and well-being of humanity, but is also severely impacting global economy and output by disruption of global trade and supply chains. The minister said economic activity across sectors has been negatively impacted, leading to loss of jobs and livelihoods. He emphasized that there is a need to provide support to businesses, especially MSMEs, to tide over the crisis and ensure livelihoods are not lost. The External Affairs Minister pointed out that the efficacy of traditional medicine systems to strengthen immunity should be recognized and that BRICS should support these efforts.
IT Minister Ravi Shankar Prasad has said that to make Aadhaar updating easier for citizens, Unique Identification Authority of India UIDAI has permitted Common Service Centres CSCs, which are designated banking correspondents of banks, to offer Aadhaar updation services. He said around 20,000 such CSCs will now be able to offer the service to the citizens. Mr. Prasad urged CSC village level entrepreneurs to start the Aadhaar work with responsibility and as per the instructions issued by UIDAI in this regard. UIDAI has set a June deadline for the commencement of the work after CSCs with banking facilities upgrade their required infrastructure and get necessary approvals. CSC CEO Dr. Dinesh Tyagi has said the decision would further strengthen the efforts of achieving the goals of Digital India as envisaged by Prime Minister Narendra Modi. Central government has asked states to advise employers of all establishments not to terminate employees or reduce their wages amid the COVID-19 pandemic. Union Labour Ministry had written to state chief secretaries recently in this regard. A circular claiming to be from the Labour Ministry is doing the rounds on social media. The Press Information Bureau, while doing a fact check of the letter, found it to be true.
In our series, Experts Speak on All India Radio, we bring you the views of leading medical experts on COVID-19. Dr. Nand Kumar, Professor of Psychiatry, AIIMS, suggested to the people to stay at home, spend time with family members and practice yoga.
We are going to overcome this crisis within a few weeks. In the coming few weeks, stay at home, spend time with the family, do household works, exercise, listen to music, sing with the family, do yoga, meditation, and take care of emotional need of the family and yourself.
Dr. Anvita Agarwal, resident infectious diseases AIIMS, advised people not to be negligent and stay at their homes.
Coronavirus may be invisible, but the number of people affected are very much visible. More than 4 lakh people have already been affected all over the world, and the numbers are increasing from day to day. Don't be negligent. Please stay at home.
Well, for listening to other experts, tune in to our next bulletin. Minister for Environment, Forest and Climate Change, Prakash Javadekar, has said that today, as the world is unitedly engaged in finding a vaccine for novel coronavirus, likewise it should have climate technology as open source, which must be available at affordable cost. Representing India in the first virtual Petersburg Climate Dialogue, Mr. Javadekar stressed on the issue of climate finance and said the world now needs more. He said we must plan for $1 trillion in grants to developing world immediately.
In Jammu and Kashmir, the Union Territory Administration is making tireless efforts to reach out to the people, especially the student community who are facing hardships due to the coronavirus lockdown. All India Radio and Doordarshan Kendra Srinagar have come to the rescue of the students in delivering lessons to students to cope up with their academic losses. The two electronic channels are also providing a platform to the teaching faculty to impart academic requirements of the students. Half an hour duration teleclass on a specific subject is being aired daily on 5:30 p.m. and repeated next day at 4 p.m. on Doordarshan's regional channel, DD Kashmir. More from our Srinagar correspondent.
In an effort to reach out to maximum students and ensuring their studies not to suffer amid the prevailing lockdown in the Kashmir Valley, School Education Department in Kashmir is starting audio classes from next week in collaboration with All India Radio Srinagar. The educational broadcast will enable students to learn through the medium of radio while sitting in their homes. The teachers will be delivering lessons as per curriculum, and the same will reach students through All India Radio Srinagar. The lessons will broadcast on All India Radio during the daytime, for which time slots have already been specified by the station authorities. Directorate of School Education Kashmir has already started teleclasses for the students on March 26th through the Kashmir channel of Doordarshan Kendra Srinagar, and presently 2 classes are aired daily covering the syllabus of elementary and secondary classes. This is Sunil Kohl for AR News from Srinagar.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Dr. Narendra Saini, former Secretary General, Indian Medical Association, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115-767. You can also ask questions on the telephone number 011-2331-4444 and post queries on our Twitter handle @AIR News Alerts by #AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards.
Celebrities from different areas have been appealing to the people to join hands in the fight against COVID-19. Bollywood actor Varun Sharma appeals to people to stay at home during lockdown and help contain the spread of coronavirus.
नमस्कार दोस्तों, ये जो कोरोना वायरस की जंग है, हम सब मिलके इसको लड़ रहे हैं और हम जीतेंगे। प्लीज आप सिर्फ घर पे ही रहिए, बिल्कुल भी बाहर मत निकलिए। इससे आप अपने आप को बचा रहे हैं, अपने घर वालों को बचा रहे हैं, अपने दोस्तों को बचा रहे हैं, पूरे देश को बचा रहे हैं। प्लीज लेट्स जस्ट बी एट होम, लेट्स जस्ट स्टे एट होम एंड स्टे सेफ एंड यूनाइटेड वी स्टैंड एंड वी विल फाइट दिस.
Actor Kriti Sanon talks about the importance of keeping physical distance while going out during lockdown.
Guys, they're very small, basic things that we all can take care of. If you're stepping out to buy grocery, make sure that you're at least at a 6 feet distance from each other. Do not touch anything, wear a mask. Do not touch your face. Come back, wash your hands for at least 20 seconds. Sanitize everything that you've touched. अगर आप अपनी लिफ्ट में जा रहे हैं तो लिफ्ट का बटन हाथ से नहीं दबाएं, एल्बो से दबाएं. If you're a righty, use your left hand to open all the doors and turn knobs. Stay positive, stay fit, stay at home.
Employees Provident Fund Organization, EPFO, has settled about 13 lakh claims, including over 7 lakh COVID-19 claims under the Pradhan Mantri Garib Kalyan Yojana package, PMGKY. This involves dispersal of over 4,684 crore rupees, which includes over 2,000 crore rupees COVID claims under PMGKY package. The Labour Ministry has said the exempted PF trusts have also risen to the occasion amidst the COVID-19 pandemic. The Asian Development Bank has approved $1.5 billion loan to India to help fund its fight against coronavirus pandemic. The loan has been sanctioned with a view to support immediate priorities such as disease containment and prevention, as well as social protection for the poor and economically vulnerable sections. And now, before we end, the headlines once again. Health Minister Dr. Harshvardhan says 300 districts in the country are unaffected by COVID-19. Progressive increase in COVID-19 recovery rate in the country, over 7,000 patients cured and discharged. BRICS foreign ministers discuss impact of COVID-19. India emphasizes on reforms of multilateral systems to deal with the pandemic. Government calls upon all states and union territories to facilitate interstate movement of trucks and lorries carrying essential goods. Wheat harvesting across the country continues at brisk pace amid lockdown, and UIDAI permits around 20,000 common service centres to offer Aadhaar updation facility. And with that, we end this special news program on COVID-19.